Thermography AI enabling efficient diabetes chronic care.
Hello everybody, I'm Georgi from Kelvin Health, and actually our mission is to make preventable deaths and suffering from conditions like limb ischemia, especially for patients with diabetes, a thing of the past. We basically use the power of mobile thermography coupled with AI to empower very efficient and non-invasive diagnostic, screening and monitoring of vascular conditions. Actually, Kelvin Health started as a spin-off company from Imaga, another company of ours founded more than 11 years ago, which was one of the pioneers of image recognition globally. We introduced the concept of image recognition API, and we have processed more than 30 billion images for more than 130 customers across the globe. And actually, Kelvin Health started as a set of serendipities within our founding team and our loved ones. I woke up on the 12th of April 2020 with a severe pain all the way from my rib cage down to my left knee. And for 2 weeks, doctors couldn't tell me what's the problem. But the first thing that I did, we were actually 3 weeks into the very first prototyping of Kelvin Health, and I took the picture that you see on your left-hand side. And 2 weeks later, experientially, when I threw out a small kidney stone, it turned out that this has been the problem. And despite that I had went under various types of very invasive examinations, specialists couldn't tell actually what's the problem. Still on this photo, as you might see, on the right-hand side, there's like this big blue spot showing a spasm. And the fact that even with a very early stage prototype of what we did, it was able to view something that other specialists and examination methods were not able to see, keeps amazing me until today and is a huge part of my motivation with Kelvin Health. 2 years earlier, in 2018, my father-in-law Hugh nearly lost his leg because of late diagnosed peripheral arterial disease. He also had diabetes type 2. And unfortunately, more than 200 million people like Hugh suffer from peripheral arterial disease. Because of the hard access to precise diagnostics, more than 20 million people, which as a reference is more than the population of Florida or a whole European country on average, develop critical limb ischemia. A very bad condition that first takes your limb, then kills you in less than 5 years in almost half of the cases. So patients with diabetes across the world are among the most exposed, like Hugh, to peripheral arterial disease and other vascular problems. And a huge percentage, more than half of the mortality of patients with diabetes actually come from various types of cardiovascular disease, including critical limb ischemia, major amputations, and complications due to the reduced quality of life afterwards. Unfortunately and ironically, patients with diabetes are among the hardest to diagnose with vascular problems because of their increased tolerance to pain and their typical medial arterial calcification. Also, they have the highest risk of complications like amputation, and especially certain type of ethnicities and low economic social index population has even higher chance of developing severe complications. The black statistics in US alone show that more than 30 million people have diabetes and more than 80 are close to developing this condition. And at the same time, 12 million people have peripheral arterial disease, but only 10% of them know about this condition, and typically they discover when it's way too late to have a good recovery. This is Professor Ivo Petrov, and when vascular patients finally arrive at his office, typically after being misdiagnosed with orthopedic or neurological problem, they need to be examined fast, and because of the severity of the condition and the limited throughput of the specialist. But unfortunately, non-invasive methods like ankle brachial index, the ABI index, and Doppler ultrasound typically give suboptimal results in terms of precision, especially for patients with diabetes. On the other end of the spectrum, we have X-ray angiography, which is very invasive, requires the injection of a dye, typically a hospitalization and multiple hours of radiation to detect the actual severity of the condition. So technology actually brings a promise to efficient diagnostics for cardiovascular disease, and in particular peripheral arterial disease and critical limb ischemia. Because our local body temperature is bidirectionally related to our blood flow, there might be certain types of anomalies in the blood flow, like inflammation or actual blockage of the vascular system, that might tell about a vascular problem. And with collecting enough samples, we can train precise enough machine learning models that can detect vascular conditions. This coupling of thermography and AI makes their application very capable in multiple therapeutic areas. Currently, our main area of focus being vascular disease and peripheral arterial disease. So using our image recognition expertise, we started building a solution that is as patient-friendly and as easy to use as the specialist or the GP or even his wife taking a thermal image of him. Here, even with a naked eye, we can see the difference between a pair of healthy and unhealthy legs in terms of limb ischemia. But we actually decided to be able to detect fine-grained details, and we created our specific data collection and medical annotation platform where we can collect multiple samples of patients, currently amounting to more than 6,000 thermal images with medical annotations. We can segment automatically the different zones of the legs based on arterial zones and angiozones. We can do the same thing for head, for ischemic stroke-related blood supply zones on the head. And we can automatically detect the level of problem with perfusion in each of the zones that we can automatically detect. So this is how the process looks like. Basically, it's as easy as taking a thermal image with a mobile camera as portable as this one attached to your phone, then doing the segmentation and the analysis of the different zones. With the team of Professor Petrov, we witnessed that X-ray angiography actually can be compared, or thermography can actually be compared in terms of global and local presence of vascular problems to the very invasive X-ray angiography. Even in cases when Doppler ultrasound specialists might miss vascular problem, even in the current research stage, we were able to detect this, and then these conditions have been confirmed with X-ray angiography. Specific conditions like global blockage like Leriche syndrome can also be very easily detected using our approach. Very interesting application is the evaluation of therapy before and after a specific revascularization procedure, in this case of finger ischemia. And our specialists got so excited that they decided to start taking thermal images of any vascular patients, including patients who are suspect to ischemic stroke. And as you can see here, we can detect various types of anomalies that are confirmed with angiography before and their recovery after revascularization procedures of the right carotid internal and external arteries. So we are already partnering with multiple healthcare providers and pharmaceutical companies on this observational study, currently amounting to more than 910 patients. These are across multiple continents, and the international vascular specialists themselves are excited about the immediate impact that Kelvin Health can have on their practice even in its current research stage. So Kelvin Health has the capacity to transform the standard of care when we talk about vascular screening, monitoring, and diagnostics, because it's non-invasive, rapid to use, very precise even for patients with diabetes, and not dependent on a specific type of specialist like a Doppler ultrasound specialist, for example. Our penetration in the healthcare system starts with secondary care, but then we want to expand to primary care and even enable the patients themselves to have such devices for multiple conditions, not only vascular and not only PAD in their homes in the not so distant future. Just to visualize a little bit complex the patient journey alternation in the case of usage of Kelvin Health, but basically we can enable even the non-specialist to take a thermal image, to do rapid triage, and then eventually skip the ABI index and the Doppler ultrasound and advise if needed or unneeded to do X-ray angiography. Also, as I briefly mentioned, after procedure, we can assist in the monitoring, immediate monitoring, but also regular follow-up monitoring of the patients, even in a remote context if that's required. We can imagine also a situation where we have like a self-scan screening booth in pharmacy stores, in primary care practices, or in any other way that would enable wide population screening. So we believe that thermography AI could be the next cornerstone of vascular diagnostics because of the easy access and affordable price of thermal hardware nowadays, the ability to apply state-of-the-art machine learning algorithms, and the fact that healthcare is moving so much closer to the patient in a patient-centric way. So if you also believe that a healthcare company should positively affect the lives of as many people as possible, we're happy to discuss how we can eventually join forces. My colleague Georgi and I are here and we'll be happy to talk. And we also have our booth in the entrance of the hall. Thank you.